Writing nursing care plans in the simplest way possible. And why is it important to write nursing care plans? Well, stick around and find out. Just an FYI as we start the video is that we have left timestamps below of the different subheadings that we are getting into. Anywho's, I hope you find the content useful and the video enjoyable. Take care, you guys. Hi everybody, I hope you're doing well. My name is Naskate and I'm from Elevate Nursing. Today we're talking about nursing care plans, why it's important to write them, and a few tips on how to write them the simplest way possible and in the fastest way as well. So what we aim for is speed, write them really quickly, write them efficiently, and that they are effective nursing care plans. So let's dive right in. Builds up your critical thinking skills as both a student and a nurse practitioner. Well, how does this come about? Well, it's a bit of a double-edged sword. The first is that it's important to have critical thinking skills in order to write an effective nursing care plan. And secondly, it's that the more you write them, the more you build your critical thinking skills. So it's a win-win, and in the end, you realize that you would write them off-head without really having to take some time on it to individualize patient care. Now, patients come to us in different circumstances from different backgrounds at different times in the illness process, I would say. So it could be during the prevention step, could be during secondary care, during tertiary care, and so on. And based on this, then you would be able to write a nursing care plan that is straight on down for this one client, and that way you'll realize that you would have improved patient outcomes. A third reason why it's important to write a nursing care plan is it promotes continuity of care. Basically, when you meet a client and you write down the priority needs and you're able to write a nursing care plan based on their priorities, then whenever you hand over, having written down your goals as well and the evaluation, when you hand over to another nurse or another healthcare provider, then you'll realize that with this one goal, then you will be able to achieve a similar goal within the team and as well as a client, because a nursing care plan is a document that is not exclusively written by a nurse. It's also inculcates the participation of the patient when it comes to their own care process, and it allows them to actively participate. If you involve them, then they would be able to actively participate in the care process, and that way you'll have improved patient outcomes. But back to the point of how it allows continuity of care. Well, once you hand over to the next person and the next person hands over, then they will be able to do an assessment during that period of time to see that these goals have been met or not. And if not, we'll create another plan to make sure that these have been met. And that way you have a common goal and a common unit, which directs me to the next point, which is it improves teamwork. And a nursing care plan usually it's written by a nurse basically, but it involves the activities of other healthcare providers. So it would be that you would invite a physiotherapist if there is need. It would be that you would administer medication that is prescribed by a doctor and provided by the pharmacy team. So you see that if you have this put out together, then every individual in the healthcare team knows that they are participating in achieving a certain goal. So that way it improves teamwork. Another reason why it's important to have a nursing care plan, it's a legal document basically, and it usually serves to protect the patient, the nursing team or the nurse or the student, as well as the facility and so on. So it's important for a third party to be able to see that these are the intentions of this team and these are the intentions for this patient, and that way whenever something comes up, then you're able to defend yourself based on a nursing care plan. Another reason why just around that is for compensation from an insurance team or an insurance company and so on, for the patient sometimes or for the facility. So whenever you have put out your goals of in a nursing care plan, then as this third party comes in, then they would see that this is the plan and these were the achievements that were made, and therefore the patient needed this. The next point is prioritization of nursing care. Now, whenever you write a nursing care plan, you're going to write it as the first diagnosis that you're going to have is an actual diagnosis, and as you go down, the last one will be a risk diagnosis or one that is about to be resolved. So in that sense, whenever somebody looks at your nursing care plan, then they would see where the priority of this patient sits, and therefore the nursing care would be around that priority as well, considering the rest, but would be around the priority of this patient. And as well, you have the assessment section, and they can tick it off the achievement of this care based on the assessment. So let's dive right into the 3 simple steps to writing a nursing care plan. Why you would want to write a nursing care plan really quickly is because there is an obvious shortage of nurses, not only here in Kenya, but all over the world. So whenever you meet a client and you want to provide the best nursing care, to efficiently use the time that is provided for you, and to, for reasons of economics and so on, to have an effective nursing care team, even if you're short-staffed, then having a nursing care plan will set out the priorities for you and you're able to achieve them very quickly. So the first step in writing a nursing care plan is data collection. Where do you get this data? Basically, it's the presentation that you receive from your patient whenever they come to you. Whenever you do a head-to-toe assessment, that's one. The reports that you're given by the patient, how they feel, or the past medical surgical history or present medical surgical history, so on. The other source would be from the file of the patient. It could be that they have been here before, or they have been, this is a returning patient, or it could be that they have a file, I mean they have been in the unit for quite a while, so you can get the history from that. Another step is from the healthcare team, because you have the doctor who has seen the patient for a certain period of time, you have the physiotherapist and so on, and other members as well. So you can find out from them as you speak to them and find out, oh, how is this patient doing and what is the way forward, and have you seen any changes within a certain period of time. And that way you're able to know that, was this effective before or not? If it was not, then you're not going to use that method of, a plan. But if it has not been used before, then you have the option of exploring that method. The other way of getting patient information is from speaking to the next of kin, the person who has brought in the patient, if it is somebody who is not conscious or is a minor that is not able to express certain emotions or certain symptoms. The second step is analyzing this data. Now that you have your data and it's written down often in a paper or just a rough book, then you categorize it. So you list it down in terms of the subjective data and the objective data. Now, subjective data is what the patient expresses to you that is unquantifiable. So it could be that I have pain, severe pain, that is rather subjective. But if a patient tells you I have pain that is 9 over 10, then that is objective in terms of quantifiable. Or it could be that they are tachycardic, let's use that. And then you have a tachycardia of, let's say, 130, for example, which should be 100. And then it could be that the patient is telling you that I really feel that my heart is racing. So that is, one could be subjective and the other one is objective. So that's the difference. As well, another way of an analysis is putting together information that is related. So if you have in your mind already a sketch of a diagnosis, let's say you have symptoms of, you notice that these are symptoms of acute pain. So put them together, that the patient told you that they have pain that is 9 over 10. You can see that they are tachycardic. You have the information that they're tachycardic, and as well, you can see that they are diaphoretic. That means that they're sweating. Then this could be symptoms of pain. And then, so those that you group together. So go on, group all the information that is related to each other that would lead you to a certain diagnosis. And this is another place where it's important to bring in the medical diagnosis. This one is a bit controversial, but I'll tell you the truth is that whenever you write a nursing care plan, a major consideration should be put on the medical diagnosis or whichever diagnosis that has been provided by the clinical team. And that way you would understand the pathophysiology. Once you know the pathophysiology of a certain condition, it makes it so much easier to write a nursing care plan, because one, you know the causes of this, you know the management of this, you understand what causes. The other one, it would be that you have acute pain secondary to ischemia, for example. So that way you're able to come up with a nursing diagnosis. And on a separate video, I promise we're going to have the differences between a medical diagnosis and a nursing diagnosis, and where the two come together so that you can write an effective nursing care plan. Now, the third step in writing a nursing care plan, now that you have all your information put together, is the translation. Because you have put them together, you have come up with a nursing diagnosis, now you translate them onto paper. And this is where the different steps come in, like the different columns. You could have a 5-step or a 7-step column. Just put it down in writing and include the name of the patient, just the demographic data, including the time that you have done this assessment, and so on. So those are the 3 simple steps to writing it. Some of the most important points to consider when writing a nursing care plan is that understand the pathophysiology, understand the background of the patient, include the patient in the nursing process, and as well remember to write in a form of priority, like the first one is the most urgent and then the last one would be the less urgent, and therefore whenever you have the document, then you would see which is the most urgent, and that way you will attempt to do it faster. I hope this will be effective. You guys can go on ahead, write a nursing care plan, try one if you don't have a patient, or look for a case. I will put down a link down below to a draft of a nursing care plan, which would be the structure of it. As well, I will put in links to a few case studies, and from those you can write a nursing care plan and share them with me. Let us know how it went, and if these tips were useful or not. I look forward to hanging out with you guys, and until next time, elevate nursing. Bye bye.